So in Monmouthshire, we now have 12 mentors, and we will have another 5 after the next piece of work. What we did is we took the collaborative communication training and we sort of broke it up into bite-sized pieces. The bite-sized pieces that we felt people needed the opportunity to revisit and then to practice. And it's practice, practice, practice. So we work in pairs. The person that I work with is a direct care lead. OTs and physios work together with social workers. The pairs are you know, you're not all social workers anyway. And we each pair tries to deliver a mentor session 3 times a year. The sessions are about 2 hours long. We normally have somewhere between 8 and 15 people coming to a mentor session. They're bite-sized pieces of the training, as I say. And these are the overarching sort of headings that we advertise. Who benefits from coming to these sessions? Every member of staff benefits for different reasons. Eve and I often talk, and with Julie, our head of service, we often talk in terms of our workforce loosely falling into thirds. A third spent a day with Rhoda and thought, oh my God, this is fantastic. I want to, you know, get on with it. Then there's a third who think, oh, this is the emperor's new clothes, you know, we're going to be, we've done this before, it'll soon go away. And then the third in the middle who needed a lot more support. So the mentor sessions, people can self-select, but equally, as supervisors and team managers, for people who are struggling and finding it a bit more difficult, you can direct them to those sessions. So it's somewhere that you can pass people on to continue to have more help.
Okay, like Ailsa said, we do lots of training with people. We've done lots of collaborative communication, but still there are times when you think, what is it about this that people are struggling with? Why is it that they don't get some of this? Or do they get it, but they just find it quite difficult to write it down and to record it? So despite all the efforts that we've put in, like Ailsa said, we have an IT system now whereby people have to put personal outcomes down at the end of every assessment or through the assessment process. And they are scored, so from the person themselves. So we took some of the outcomes, we took about 700 of the outcomes. And I read through them, and like Ailsa said, from a third's perspective, a third of them you sort of go, whoa, that's amazing. A third you go, you're getting there, but it just needs something else. A third were, have you been listening? Do you understand? Do you know what we are doing and why? And then that's a third makes 1, but there was still also a little percentage that were complete howlers where you think, oh my God, are you really qualified? To be hoisted by the nurses.
Yeah, that was one this week.
That was a personal outcome on somebody's file. And you think, really? So we've been doing that. We did this activity, this exercise, which went down really well. So basically, we put loads of outcomes on people's on tables, and people in teams looked at the outcomes, and they had to score them. They had to rate them. Is that a red, amber? Is that a red outcome, red being not a great outcome? Is that an amber outcome, as in you're nearly there, or it could be good? And is that a green outcome, which is great? Now, the impact that this had on our staff has been really, really, really quite inspiring, because they've all looked at some of those outcomes and gone, oh my goodness, I really do write things like that. And they've really thought about how they have so easily at times slip from being person-centred and person-focused back into that service sort of language, or back into professional language. You can read some of the outcomes and you know whether you're looking at the outcome of a social worker, a physio, an OT, by the language that's written.